Hello friends, welcome to my channel Med Simply Learn. In today's short video, I will be discussing the ECG changes in the hypokalemia. So the brief introduction about hypokalemia. First of all, definition. Hypokalemia means low blood potassium levels, that is below the 3.5 milliequivalents per liter. Normal range is 3.5 to 5.0 milliequivalents per liter. Coming to the causes of hypokalemia, it can be due to increased loss through the GIT or through the kidneys or through the skin, and due to the intracellular shift of the potassium, as in the patients taking insulin or beta agonists. And third important causes are due to inadequate intake, due to starvation or poor nutrition and alcoholism. Now coming to the ECG changes in the hypokalemia, the first and most important ECG change, which is also the hallmark of hypokalemia, is the presence of U waves. These U waves are the small waves after the T waves, and these are best seen in the V2 to V4 chest leads. Okay, and the mechanism for appearance of U wave is prolonged Purkinje fiber repolarization and slowing of the phase 3 of the cardiac action potential. And the significance is these U waves are most prominent when potassium level is below 2.7 milliequivalents per liter. Second important ECG change seen in hypokalemia is the ST segment depression. And this ST segment depression, which is seen in hypokalemia, is the downsloping depression. As we can see in the picture, we have three types of ST segment depression. One is upsloping, another is downsloping, and third is the horizontal type of ST segment depression. In hypokalemia, we see the downsloping ST segment depression. And cause is altered ventricular repolarization, which affects the ST segment, leading to the depression of this ST segment. And the clinical implication of this ST segment depression is this ST segment depression we have to differentiate from the ischemic changes, or mainly especially the digoxin toxicity. So we can differentiate it through other ECG changes of hypokalemia and also through the clinical history of the patient. Then another is important ECG change is T wave flattening or the inversion. So in hypokalemia, the T waves are flat or their amplitude is decreased. Sometimes also they are inverted. Okay, and generally this change appears even before the development of the U wave, and this is mainly due to the delayed repolarization of the ventricles. And finally, last important ECG change is prolonged QT interval. This QT interval, that is from the beginning of the Q wave to the end of the T wave, is the QT interval. This QT interval is also prolonged in case of hypokalemia. Actually, this is not a true QT prolongation, but rather due to the appearance of U wave, there is increased QU interval, which appears as prolonged QT interval. And these are the ECG changes which we find in hypokalemia. Early recognition of these ECG changes and prompt replacement of potassium can save the life of the patient. So that is why we should know all these ECG changes well. Thank you.